Hello, I'm Ms. Stratt, and I'm going to be demonstrating a sterile wet to dry dressing versus a clean dry dressing to the PN students here at BHCLR. So first thing you want to do is come in, introduce yourself, to the client. Make sure you have the right, the right client. Can you tell me your name and date of birth? I'm Ms. Stratt, and I'm going to be doing your dressing change. Always tell them what you're going to be doing. You got to check the order. The order will tell you what kind of dressing you'll be doing, what supplies you need, and where the wound is located. So determine if they have any allergies. Are you allergic to any tapes, wound products, any type of latex? Determine any allergies, and then assess their pain level. What's your pain level? If they need pain medication, they need to be medicated 15 to 30 minutes prior to the dressing change. So always make sure you tell them what you're going to do. Then you gather your supplies, do your hand hygiene, and I go ahead and put on my clean gloves to take off my dressing. Only expose the area that you're going to be working with. I'm going to expose a little more so the camera can get the idea of where the wound is. And so to remove the tape, you want to take it and pull it towards the wound. So remember, wounds heal towards the center, right? So we're going to take the tape and we're going to pull it towards the center. Be real gentle taking the tape off. Sometimes it can actually cause skin stripping. So you want to peel that back, kind of take off the layers that come off, and then notice what the dressing looks like. If it has an odor, what kind of drainage is there, how much is there, that kind of thing. So I always sometimes take that and just fold that into my glove. Then you'll do hand hygiene again. Okay, so you've got your supplies set up, and sometimes I glove, to open the packages, sometimes not. We'll use saline to clean because there will be an order, some kind of order for cleaning, cleaning the wound itself. In order to keep this sterile, you want to take the cap off, lay the cap up like so, and then leave your bottle like this. Check the date. The date on saline is good for 24 hours. So anything after that, you have to discard. Okay. I always set up my sterile field going away from the patient, and I always get my table pretty close to where I'm working. These packages are pretty tricky. You can take them and pull them back like so. Some of them want to come back on themselves, so you just have to work with them. And I always talk to the client. This kind of relieves some of their anxiety. We'll try not to go over your field if possible. Reach around, grab your saline, because you're going to need to clean the wound and then pack it. So be sure and just pour a little bit. If you pour too much, you can always wring it out. Don't get too close. Here we go. You can set that back, put the cap on it, and you're pretty much done with that. Okay. Okay, so since there's no room on my table, I'm going to go ahead and put my sterile gloves on over here. I did already set my tape up. I went ahead and put a couple pieces of tape on the table there, just because I worked alone, and it made it easier for me. Okay, now you have your sterile gloves on, and Your saline is poured on your gauze, so you want to take the excess and just wring it out. And I'm going to clean your wound. It may be a little cold. So you take one, you can fold it if you'd like, and just go straight down the middle and discard. Okay. The adjacent tissue, away, discard. Now the book doesn't have a specific, for cleaning the adjacent tissue. If you want to clean it close to you, I always just do away and then discard, and then closest to me and discard. Try not to drag your gauze over the wound bed itself, because then you'll cross-contaminate. Right. And then we've got one left here. Just got a lot of saline in it. And to pack it, sometimes you may need more than one. To pack it, I call it fluff and stuff. So just take it and kind of do it like an accordion. And you just gently put it down in the wound. Okay? If you push and poke and things like that, you'll prevent the wound from granulating in. Okay? That one could probably use another one. So we'll just make like we have one. And then you want to cover it. And you can cover it with an extra if you need it. Because these are not very thick. And then you cover it with an ABD pad. And this makes it convenient to have your tape, at least a couple of pieces already tore. This one has the date on it. You always want a date. Usually time and initial. So the person that's coming behind you can see that it has been changed. Okay. Take that down. Let the client know that you're finished. Document how they tolerated it. Document their pain level afterwards. Any drainage, what the wound bed looked like. If it had granulation tissue, if it had necrotic tissue, if it was painful or uncomfortable. You want to document all of that. You also want to clean off this table between your dressing. You always want to clean your table off. All right. Is there anything I can get you? Always put their table back like you had it, with their, personal items on there. Put the side rail back up, because I put it down so I can be close to the client, and put their bed down to the lowest level, because this is important. To have it at the level that's comfortable for you and your back. I always want to provide privacy. If I didn't mention that, I always want to provide privacy. Hand hygiene. Okay, so we're going to look at this incision on their chest. This is a dry dressing. And these gowns just kind of snap. They just kind of snap open. So after hand hygiene, everything is the same. Checking the order, identifying your patient, providing privacy, hand hygiene, assessing. All of that is the same. Taking the tape off is the same. Pull it towards the incision, okay? You take that off, assess, any drainage on the dressing itself. Look at your incision. There's staples present. It's a little bit of, looks like a little bit of pink. I wouldn't call it red, maybe a little irritation, but staples cause, irritation to the skin when they come in contact with the skin like that. So I'm hand hygiene again. Have lots of gloves. Make sure you have lots of gloves. This is going to be a dry dressing. So we're going to need one to clean, one to cover. And I'll make sure I have a piece of tape down Gonna do your saline the same way. Open your bottle, protect your cap. This is not a sterile procedure. You don't need an ABD pad because there's not a lot of drainage most of the time on an incision, and many times they're left open to air. Okay, and so to clean, you just want to moisten just a little bit. You turn your cap. Okay. Use your non-sterile gloves, clean gloves. I am gonna moisten that just a little bit. I'm gonna clean down the center. Always clean down the center first. Discard. Clean away and discard. And then clean the tissue closest to you and discard. And most of the time, maybe one of these folded is plenty. It gives it just a little bit of extra, absorption. Take your tape. You don't want to put too much tape on the skin, overlap it too much, but enough to keep it on the skin, especially if the client is active and up and moving. So you take your Sharpie, you can write gently. Don't ever do that with a pen because you have to push down and it's uncomfortable. Okay, and the same way, and you see I took my glove off, so I really didn't contaminate my Sharpie, but I usually alcohol it as well before I put it back in my pocket. So hand hygiene, replace their gown, make them comfortable, answer any questions they have, give them some teaching, tell them they can get up and move around with their dressing. If it drains outside the gauze, then to call us and let us know. If they have experience any pain, or discomfort, they need to let us know as well. So bed down to lowest position, side roll up, all your safety features, and be sure and document. Document what you saw, what you found, and how the client tolerated it. Okay? Thank you very much.